Hello and welcome again to our third of a four-part series for the Swope Health Black History Lunch and Learn series. We have with us today a very special guest, Frank Ellis, who is the founder of the Swope Health Community Health Services Network here, and we're so glad to have him here with us today. Welcome, Mr. Ellis.
Glad to be with you, Dran. Thanks for having me.
Thank you so much. And thank you so much. And so if you've been tuning in these last 2 or 3 weeks, you know the format.
Yes.
We're going to let them have our, let you present for a while here, and then I'll follow up with some questions. And again, if you are listening here as an attendee, please feel free to put your questions in the chat. And once we get through the questions and Mr. Ellis makes his presentation, we'll ask some questions from the public and what's going on. And so we have both Swope associates listening in, and this was open to the outside public as well. So we are really happy to have you with us, and I'll turn it over to you, Mr. Ellis.
Well, thank you very much, and congratulations to you and Swope for your leadership and launching this Black History Month Lunch and Learn series. I'm happy to be a part of it, and I'm glad to see you guys are continuing the rich legacy of Swope. Ron, I took your email that you sent me, and I tried to arrange this brief presentation around your guidance. So I thought basically the purpose of it would be to share a little bit about my life and my career. And the framework you gave me was very interesting because I don't know who all is attending, and I don't have a feel for the number of people. So I took the contextual framework that there are new managers, old managers, folks who are part of Swope, folks who are just interested in the community, those folks who may have been board members, or those folks who are just community stakeholders. So that's the contextual framework. I'm going to share a little bit about some of my insights that I've learned about leadership and leadership in its broadest context. Everybody's a leader in some way or another, not by title or role, but we all are leaders. So hopefully I can share some insights on what constitutes good leadership and share a little bit about the rich history of Swope. I'm kind of at a disadvantage, Duran, in that all the slides that I have here are from my own records. I don't know if Barnett is still there. Dan, what is his name?
Dan is still here, yes.
Dan Burnett. Well, Dan has a great history of all the archives of the history going back to Swope. He and Brenda Polofsky. And I think Dan kept all those archives. And if I could make a suggestion, I think it would be helpful while some folks are still with us. I mean, folks like Sonny Gibson, from the old Model Cities days, folks like Joanne Collins, Gail Hollis, a lot of folks who were on the peripheral but were very politically active that can put the context of Swope. And let's just do a documentary of 50 plus year history and set up the advisory board of maybe some of the folks who worked with me at Swope to kind of guide a series of a documentary of Swope. I think that would be very helpful because all of us aren't going to be around forever. And we don't want to lose that history. So that's just a thought. And then we'll end it up for questions and answers. My story, well, I'm a native Kansas Cityan and born and reared here. And for those of you who go on Facebook, you can see pictures of my whole family and my father and my mother and my sisters and all of that. And you'll see a lot of pictures of Swope associates and board members and a lot of history that's on my Facebook page. So I encourage you guys anybody attending the webinar to go on my Facebook page. I am a man of faith, very much so, as is Swope, and that guided our history. I grew up in the Episcopal Church, went to University of Michigan School of Public Health, but I didn't want to go to the war. And that was the only way I could get out of going to the war. During Swope's history, there were a lot of faith leaders that helped Swope along the way. Dr. Hartsfield was my pastor at 2310 Lindenwood, Metropolitan Missionary Baptist Church. Reverend Cleaver was very instrumental in helping us. Dr. Ivy Ganaway, Reverend Ganaway, she led our community health project and at Swope to reduce infant mortality and that. And we had a health ministry program that Reverend Handy led. And Reverend Tyndall was very instrumental. So Swope's rich history has been involved with a lot of faith leaders throughout our history. And I like to give credit to God for the many successes that we had. I know very well the segregated history of Kansas City. And I grew up as an angry young Black man, quite candidly. And it was that anger that really motivated me to make a difference, quite candidly. I remember that we could only go to Fairyland Park one day out of the year, which was on 63rd Street. And I remember separate toilets, separate drinking fountains. Anyway, so I have a very strong history of that. I think if there was a book that motivated me for the young folks, is The Spook That's Set by the Door. You don't hear much about it, but that book reminded me of how you can turn that anger into positive. That motivated me to make a difference and to be a community activist to empower and provide health care. I'm married to Dr. Janice Ellis, best friend. We've been happily married for almost 35 years now and 36 years. We've got 3 kids and 4 grandkids. And currently I am managing partner of our family company called PL Strategies. I do consulting work, executive coaching, real estate consulting, and even for all types of industries, even outside the health industry. So I'm in finance. We talk about the history of community health centers, neighborhood health centers. If you go on the internet, you'll see some stories about how community health centers got started up in New York in the early 1900s. But that's, in my opinion, that's an attempt of New Yorkers to try to capture the momentum that neighborhood health centers have had across the country. The acceptable definition of the history is that by NAC, National Association of Community Health Centers. And there was a Dr. Geiger, who was a young Jewish doctor, a civil rights activist, who was formatively lived in Harlem under a Black fellow by the name of Canada Lee. And he took Canada Lee took Dr. Geiger under his arm when he ran away from home. And it was during that time that Dr. Geiger got exposed to Adam Clinton Powell and Langston Hughes and a lot of the Black leaders during that time. And he had an opportunity to go to South Africa and noticed how a community-based health model improved the health outcomes for the poor and impoverished in South Africa. It was during that time that President Johnson's had the war on poverty, and he offered, Dr. Geiger took that opportunity to present 2 proposals to help fund neighborhood health centers. The first health center was started in Boston, Massachusetts, and the other one was started in Mount Bayou. In Kansas City, the first health center was started by Dr. Sam Rogers, and he submitted an application to the Office of Economic Opportunity, OEO. And Mr. James I. Threet, you may have heard of that name, some of us in our audience. James I. Threet was a very brilliant and creative assistant city manager and director of the Model Cities program. And he submitted an application for a demonstration project under the Model Cities program. The Model Cities and the OEO programs were 2 separate different systems. The Model Cities program was supposed to demonstrate how you could become financially self-sufficient. You were supposed to hire, train, and deliver healthcare on a demonstration basis. And the community was divided into various regions, territories, if you will, and each community had its own board, and each community would make representation or nominate a representative to serve on the Model Cities board. OEO was totally subsidized, and it was supposed to be free to all patients that came, regardless of the ability to pay. Model Cities had a sliding fee scale. Ultimately, the OEO and the Model Cities program were merged together and came under HEW, which is now HHS. Mr. Threet is the one who initiated the organization known as Model Cities Health Corporation in November of 1969. And it was under that nonprofit organization that he hired consultants, Arthur Anderson and Company, which was a big CPA firm. And he hired 3 individuals out of Western Missouri Mental Health, Dr. Charlie Wilkinson, Dorothy Johnson, and Cornelius Reed. And it was under that nonprofit that they submitted the application for a planning grant. The first person that Mr. Threet tried to hire full-time was a fellow by the name of Charles Christmas as the executive director. And I just got out of university, I just graduated from University of Michigan, and he hired me as clinic manager. Mind you, the board hadn't been formed yet. So Mr. Christmas came and he learned about the recruiting process for the new board, and he saw the financing of how tenuous it was for the Model Cities Health Center to get started. He decided no. Well, I was right out of school with a wife and a child on the way, so my situation was a little different. So I was hired as clinic manager and as acting executive director. We weren't seeing patients then. So from 1971 to 2014, my 43 years there at Swope, there were certain guiding principles that really led me in my direction. I took a holistic approach towards healthcare, body, mind, spirit, and economics. You heard me talk a little bit earlier about our spiritual involvement at Swope and our various health ministry programs. And this was all consistent with the Model Cities area, with the Model Cities initiative. I remember Mr. Three and a man, one of the charter members of the organizing of the Model Cities board, a fellow by the name of Meyer Goldman, who ran the Labor Beacon. They set me down one day and they told me, young man, which I was very young at the time, this is a business, first and foremost. No matter how noble your mission is, without resources and money, you have no mission. And a lot of the associates that were with me at the time remember me saying, no money, no mission. And they used to drill into me, Mr. Threaton and Meyer Goldman, say, if we ever lose sight of that fact, our organization was going to die. So that was kind of the mantra that we had. I served as an acting director for almost a year until the board, which finally got organized, hired a physician from Wyandotte County by the name of Dr. Bass. And he served as executive director for about 3 years when the feds came in to audit. The feds come in every 3 to 5 years to audit FQHCs. And when they audited, they wanted to check the record, the medical records. Well, Dr. Bass would not let them look at the patient records, which was a terrible mistake on his part. So long story short, they gave the board a 90-day cease and desist order. And the 30 conditions were on that. And so the first condition was they had to fire Dr. Bass. And so I told the board that I asked the board, I said, I will submit a reorganization plan, a compliance plan, with the condition that you appoint me as executive director. If I can't get the cease and desist order removed within 30 days, ask for an extension and find yourself a new executive director. Well, we were able to get the cease and desist order removed. The board appointed me as executive director, and I guess the rest is kind of history. Swope is a very blessed organization, and there are a number of great board members and professionals along the way that are really too numerous for me to mention here. But the thanks go to them. The credit goes to them. And like I said, some of those faces and names and board members and associates are on my Facebook page, but then Dan Burnett has all the archives. And I really think we really should try to have a series of history of all the great work that Swope has done over the years. I think one of the keys, if I had to sum it up, to 5 reasons why Swope has been successful. First and foremost, we are all mission driven. We're dedicated to our mission. We know what it is. We're committed by it. We live it, sleep it, and we're business minded. We're entrepreneurial. We understood what our core competencies were and we built on them. We always tried to maintain a learning culture and we welcome new ideas. It wasn't a gotcha environment where we tried to play gotcha. We wanted to express new ideas and make it a learning environment for self-improvement, professional development. And last but not least, we always had patient and client and associate and employee surveys periodically to assess how we were doing in job satisfaction and career satisfaction. And we use those to make adjustments during the way. From a contextual framework, organizations, companies, businesses, no matter what industry you're in, they mirror the evolution of human beings. And so you'll see various stages of human life. I've seen scales from 1 to 3, 1 to 5, 1 to 13. But for purpose of discussion here, there are 7 stages of development for a company or individual. The seed stage, conceptualization, the startup, growth, establishment, and expansion stage. Then you have the declining and the exit stage. You see those pluses there? Well, those were the stages that you want your company or your business to be in. And we did a cultural periodic assessment of where the mindset was for most of our of our associates and our colleagues. What are attributes that you need at each stage of the game? I like to think of it as, what does your leadership mirror look like? And like I said earlier, we all are leaders. So if you look in the mirror, what is your leadership style? And you see some examples there. Why should people follow you as a leader? Why are people willing to follow you? And who you are comes before what you do. My wife Janice always tells me, your default of who you are always comes first, especially under stress. You always revert back to really who you are. What are your value sets? What are your principles that you go by? We all have non-negotiables in this world. What are they? What certain value sets, value propositions will you not tolerate? And then conversely of that, what factors in your leadership style will derail you? How do you lead change? How do you manage change? Everything is going to change. Well, as a leader, how do you manage that? And how would you describe the culture of your company or organization? And if you describe it one way, will your team describe it the same way? Last but definitely not least is, how do you define risk and how do you manage risk? After your business plan or strategic plan and executing of that, perhaps the most important question is, how do you manage risk? How do you define it? What's your definition of your risk appetite, your risk tolerance? What's the board's definition of risk tolerance if you're going to expand? All of these are key factors in turning and looking at how you're going to grow. And you make changes along the way of that definition and your definition for risk. And you try to set up a continual process improvement process to manage your strategies. And remember Murphy's Law, whatever will go wrong, will go wrong. I remember one of my board members, I've got his name down here, Dr. Leo Morton. Leo used to say, Frank, how well do you know your business? And so when we at the SCE level, we come up with a 3-year business plan, strategic plan, and I'd have to list all of the variables that would affect the success and or not success of our business plan. And we had to identify the factors, how we were going to manage those risks. And so I told Leo, I said, Leo, there's some things that are out of my control. He said, well, Frank, you need to come up with a tornado chart. And on the one side of that tornado chart there's a vertical axis. On one side are the things that you can't control that will negatively affect your business plan. And on the right side are those things that will positively affect it. And you put it as a tornado with those things that have most impacted the most with the highest percentage of risk, and you go down. And so I was telling one of my clients today earlier about this, and I said, well, if I was at Swope today, I would have never put a pandemic on that tornado chart, because we would have never guessed that a pandemic would have hit us. The simple definition of risk: will the decision be catastrophic, and how difficult will it be to recover? And if so, you have a plan B and a C to recover. And I always use the example of the Challenger 10 mission. They were so anxious to get that space shuttle off the ground that they never realized that if they launched the Challenger at 32 degrees, the O-rings would freeze and it would blow up. Here's a little history about model cities and Swope. We started in the basement of a church, 2310 Linwood. It was called Model Cities Health Corporation of Kansas City. We then moved to 4900 Swope Parkway, which is the old Swope Parkway National Bank building. As you see there, it was formed in 1969. We outgrew that building, and Ken Bacchus was our city councilman at the time. And I said, Ken, I need somebody to help me plan how to build a new building. And the politics were such that the only place everybody kept wanting me to go was in this landfill. And I'll show you a picture of that. But anyway, we brought on Chuck Gatson, and he worked for Swope at the time, and he helped me package an application to form the funding for community builders. We had Applied Urban Research, which was our research and planning, urban planning arm that was formed in August of 94. We had our foundation, Swope Health Foundation. I'm assuming it's still around. We formed that in 1984. And then we had a single asset corporation called Swope Housing Inc. That was a HUD 202 program. Then we had First Guard Health Plan, which was formed in '95, but had license in both Missouri and Kansas. And then when we went over into Kansas, Kansas said, nope, we don't want this corporation right here to come over in Kansas. They wanted us to set up another holding company, First Guard Inc., just for Kansas. And then we set up our First Guard Kansas, and it was managed by First Guard over here. So that was the overall umbrella and organizational chart before we set up SCE. Then Swope Community Enterprises, to make it cleaner so that the feds and everyone understood it, we set up Swope Community Enterprises, which was the parent. That's where I worked after we sold First Guard. And then our development team, redevelopment team, was community builders and applied urban research, and we had Swope Health Services. This is a picture taken on the top of 4900 Swope. Those Swope Parkway National Bank building. This is where you are. This is where Swope Health campus is right now. This is what it looked like. And this is the landfill that we built the campus on. And there's another picture here. This was what RE and community builders pulled together as our development plan, where we had the Thomas Rope Child Care Center, Cleveland Heights, Amani House, the First Guard building, Swope Parkway Health Center, the H&R Block Call Center, Mount Cleveland Estates, the shops. We realigned Blue Parkway, and we built the H&R Block Call Center. Our mission for SCE at the time was to develop self-empowered, healthy people in healthy communities. And our member companies, we were striving to improve the physical and economic health of individuals, families, and communities. This is a brief history of our member companies. You know about Swope Health Services, Community Builders, RE. You might not know about, in 2002, we formed Swope Community Enterprise Services. That was a back office company that provided shared services for our member companies, HR, finance, corporate planning, communication. And there was a contract agreement for all of those services to be provided by Swope Community Enterprise. We had a few other companies that we provided services for that were not part of the Swope family at the time. And then we set up Swope Center for Career Advancement in 2006. This was a workforce development program that we set up. Janice used to hear me come home complaining all the time about all the need for training and hiring folks in the community. And she told me, she said, Frank, if you quit complaining about it, do something about it. So we set up Swope Center for Career Advancement, Dr. Sylvia Robinson, and this was all private funded. DST, State Street Bank, and Waddell and Reed, they paid the scholarships for a staff of 12 or so to train their entry level. And they paid Swope Center for Career Advancement because they could train folks to get into the workforce cheaper than it cost them to recruit. So in 2006, 2007, 2008, things were going fine. My dad died in the latter part of 2007. And I became the power of attorney for the family. And I also committed in 2008 to, he died the last part of 2007. And in 2008, I committed to be chamber chair. And in the latter part of 2008, 2009, the economy tanked. And Duran, I have to tell you, these years were the most challenging of my whole career at Swope. At that time, we had maybe 825 associates throughout the whole system. We were doing about over $325 million a year collectively for the whole enterprise. We had a balance sheet, included consolidated balance sheet for all our member companies of a little less than $500 million, including all the tangible assets that community builders had and all the cash that First Guard had to sold to community enterprise. And the economy tanked. And we had to sell all of the non-performing assets in community builders. We had to lay off and totally dissolve Applied Urban Research, which made up about 10 people at the time. We had to dissolve and relocate about 100 people in Swope Community Enterprise Services. And we had to completely shut down Swope Center for Career Advancement. Now you're talking about a workforce of 800 And that was a disruption of about 25% of our whole enterprise of workforce. The SCE corpus went from about $110 million down to 60, 55 million. Everybody was losing money. Everything was losing money. I mean, that was, and during that period of time there's no easy way to shut down and lay folks off. And so by that time, I was spent, because after that, I had to become chamber chair. And that's when I retired. I was thinking about, I had conversations with retiring with several of my key board members in 2009. But that was all put on hold when the economy tanked. Anyway, you see the sites that Swope Health Services had, Lodge and Kenzetta Harris House and Curtis Franklin House. These were single asset corporations, the HUD 202 program that I told you about under the organizational chart. These were residential treatment facilities for the chronically and persistently mentally ill on 59th and 60th Terrace. Kenzetta Harris we named it after her because she was our chronic care coordinator, and Dr. Curtis Franklin was our first psychiatrist. They both passed away. Amani House was on 51st Street. That was our residential substance abuse treatment center. We had a site at St. Luke's Hospital, an emergency room where we educated patients. St. Luke's still doesn't, but they didn't want uninsured and Medicaid patients in the hospital. So we had a clinic there. We had 2 clinics in Wyandotte County, one on 12th Street, we called Swope Health Wyandotte. We had one on Quindaro, 27th and Brown. Oh, shoot, let me go back. 27th and push the wrong button here. And we had one in Northland and one in Independence. So anyway, those were the Swope Health Service sites that we had when I was there. First Guard grew out of a demonstration project in Jackson County. Jackson County submitted an application to the federal government for the whole county to be a demonstration project for HMO. And the state would pay us a capitation rate. That means they would put the health center at risk to pay for all of the inpatient, emergency room, and outpatient services for our Medicaid patients. Well, that turned out to be about $100, $105, $110 a month for every one of our Medicaid patients. And we made money with that program, primarily because we did outreach for the at-risk mothers. Well, then they privatized it and put it out to bid. And Children's Mercy and Truman Medical Center and Rogers Health Center wanted to form an HMO. Well, when we were negotiating with Truman and Children, they wanted to pay us 27 cents on the dollar. And that just didn't make sense. So we decided, and everybody told us we were crazy at the time, but fortunately the board saw the wisdom in it, and we raised $5 million and set up our First Guard companies. And at its peak, we were the 3rd largest HMO in Kansas City. We had over 136,000 members in both Missouri, 13 counties in Missouri, and the whole state of Kansas. And at our peak, we've had $240 million in revenue. We sold First Guard to Centene in 2004 for $93 million. And if you looked at our balance sheet, and for those of you who are on the webinar, if any of you came to my retirement party, my wife Janice told the real secret about how we were able to add our retained earnings on top of that, but I'm not going to go into that now. But really, all this 93 million plus the 25 million in retained earnings on the First Guard balance sheet all went to SCE. And we built it around all of our core competencies that we had at Swope. Community Builders is an A-rated community development company, still. And we were successful primarily because we met the community's needs by listening to the community. We built it from the bottom up. And Emmett and Community Builders are still doing great work right now. Again, here's what it looked like, a close-up look of where you are now. Iran, there was over 1 million cubic yards of fill that were required to fill the 70 acres that the Swope campus is on now, and it was all blighted. Vera Baker, the Community Builders Board, was initially made up of 1/3 of Mount Cleveland and Sheraton Estates neighborhood residents, 1/3 of the Swope Health Foundation Board, and 1/3 of Swope Health Services Board or Model Cities Board. You see the history, the rich history of community builders and Swope and how we cleaned up the community and all the progress we made and realigned Blue Parkway and built the H&R Block Technical Support Center, which is, that's it there. It's not, I understand they've sold it in the cities there, but that was our plan. We brought 300 jobs east of Troost for $14 million and building, and then we built the office building, 72,000 Class A square foot. So that's my brief presentation here, and I'll be happy to answer any questions that anyone has.
Well, thank you, Mr. Ellison. This was such a great conversation. And again, if anyone's listening from outside Swope or inside Swope, if you've got any questions, feel free to put them in the chat. And can you talk a little bit about, Mr. Ellis, about, when you came to Swope, you hinted at a little bit in the beginning of your presentation. How did the decision come to go to Metropolitan and start there?
Actually, that was Mr. Threet's decision.
Okay.
Mr. Threet had signed a lease under the auspices of the Model Cities Board with the First Baptist Church. That was before Metropolitan went there. And the First Baptist Church, well, their membership was waning because it was primarily a majority church, white church. And Mr. Threet put us there, and we didn't have any. The problem was we weren't seeing any patients, and the government was putting pressure on the board and Mr. Threet and myself to start seeing patients. So we had to renovate it first down in the basement. We had to first renovate it because it was the basement. I mean, they had a boiler room, and we went down there, and a lot of the planning money was used to renovate that. And I oversaw some of that renovation.
And so I know you said that the very first Model Cities program was started by Dr. Rogers with the Wayne Minor Health Center. And so how did you all decide when you putting clinics in, you had Wayne Minor and then you all came with another clinic? So did they allow some distance between the clinics? How did that work?
Well, I may not have been clear. Rogers was an OEO clinic.
Okay.
Okay, and we were a Model Cities clinic.
Okay.
And the OEO clinic, said that they wanted to put it in a housing project for poor people.
Okay. Okay.
You see, and the Model Cities program. That's why I say, you take people like Sonny Gibson. Elvis Gibson is his name, but everybody calls him Sonny. He's older than I am by about 10, 15 years, but he has the rich history of all those Model Cities programs. James Watts has a lot of it, but Sonny knows most of it because he was active in it. Sonny was active and a community activist with where the clinic should go. And he told everybody where he thought things should be. And the community decided that they wanted it off of Prospect.
Right.
And the only place that was readily available where we could, without building something new, was in the church. And it was really community driven more than anything else. Samela Gates, she's not with us anymore, but she worked for Mr. Threet. And Samela, Joanne Collins would know a lot of it, and Sonny Gibson would know. There's some others, but a lot of those people are not around us anymore. Mr. Threet's gone, but that's that rich history that captures the community dynamics. I mean, Duran, you have to remember, this was during the times of the riots. And there was a lot of community unrest. Ghetto or Gold Mine, Bernard Powell, he was active during that time. He was active in the Model Cities. He was active in OEO. I mean, we had a lot of great community activists that really wanted Black power. I mean, Black people were stepping out then. I mean, I think we're going backwards in some instances, but we've made great strides. I mean, when I look at that, if you read the Missouri Independent, you'll see they're down there arguing about taking away Cleaver's seat. This is crazy. I mean, we should be empowering people, educating people, rather than denying them. And that's why I think in some instances we go back. I mean, it's disheartening to me to see what some members of the community are trying to do, but it's also heartening to see what the young folks are doing, because they're not taking it. Just like my generation, they didn't take it. You can't take it. You've got to stand for your rights and not let anybody define you. you know, because if I had listened to what people told me, we would never have had Swope. We would have never, I mean, Swope is not the biggest health center in the country, but I guarantee you one thing, it's one of the strongest financially endowed of all of them in the country. I tell you that, especially when you look at the parent, SCE, and what it still has. It had a lot more before '09 and 10 hit, and the economy tanked. And I look at all the heart and the disruption that caused. But
Well, you know, it's funny you mentioned that, Ms. Ellis, because I want to talk a little bit about like the vision that you kind of alluded to. So give me some background and how you thought of this whole concept of the SCE and the community builders and how it was all woefully connected under one parent company.
I'll be very candid with you. One of my good friends, my mentor, he's dead now. Harold Doc Holliday. Harold Doc Holliday was a genius. Don't let anybody say anything different. Harold Doc Holliday was a genius ahead of his own time. The brother was brilliant. He was our attorney back then. And I never will forget this. I never will forget this. You want to know where the vision came from? Harold, he was our attorney. And he drove me around town one day and he said, Frank, where do you see yourself 15 years from now, 20 years from now, 30 years from now? He said, and I told him, no, he'd tell me. And he kept on pushing me like that. He said, Frank, you're not thinking big enough. You're not thinking big enough. And so finally, that got instilled in me. And I'll say this, Duran, most of my 40 years, I'd say 38 of my 40 years as a leader, I had an executive coach, which is what I do now, really. I've had an executive coach, somebody to bounce ideas off of, somebody to challenge my thinking. And I've only had 4 coaches in my life. And I don't really count Doc as a coach. If I counted him as a coach, he'd be 5th. But Doc is the one that really challenged me to be beyond what I thought I could do. And I just carried that on. And when people told me I couldn't do that, or they told me I was crazy, that just spurred me on more. But I heard that through all my career. You can't do that. That's crazy. You can't do that. You can't build that in that floodplain. You can't raise $5 million to build a HMO. You can't have health ministry in a program like that. You have to have. I say this to the young leaders. You know, don't let anybody define you. Don't let anybody define who you are or what you can do or what you can be. And if they try to define you or put you in a box, you need to find another place that will take your ideas and grow. That's why I said you want to have a learning environment. As a leader, you want people to give you fresh ideas. That doesn't mean that every idea you give is going to work, but you don't want to play I got you. You want people to feel comfortable sharing new ideas, and that's how you grow. But that's how the vision came about.
And you hit on this a little bit in your presentation about the various styles of leadership. What would you say your style of leadership was as CEO here at the Health Center?
I think it grew. I think initially I was a dogmatic leader, which got me into serious trouble.
What do you mean when you say dogmatic?
Well, do as I say, do. This is the way it's supposed to be.
Okay.
And that's not a good leader. And I paid the consequences for that. And that's when I decided to get a coach to learn. And I learned that there were different styles of leadership. I think when I ended up, I was a servant leader. I was there to serve the community, serve my associates, serve the board, serve the, and it hurt me to my heart when I had to shut all that down. I mean, that was my father had died. I'm laying people off. I'm shutting down organizations. We're losing money at every step of the way. And on top of that, I've got to be chamber chair. I could not have done it without a coach. Somebody, plus I had to have time in my personal life for my family. I mean, that without a coach or somebody to help me, I could not have made it through that period of time. I did an assessment and my stress level, my coach, I had a coach by the name of Frank Grosser. He was out of Chicago. And he gave me 3-hour assessment to assess me every kind of way, but which way would move. And it came to find out my stress level was at 95%. There wasn't any room for me to grow. So my coaching was to compartmentalize the different components of my life and how to manage those and get on track with managing each one of those. And that's the only way I made it through those stressful years, because you can't handle everything that comes at you. The only thing you can handle is how you address it. You know, you can't control everything that comes at you. But what you can control is how you respond to it.
So in your leadership style, what were some of the consequences that you noticed that sort of stopped you, make you think, hey, I need to do something different here?
Well, I'll give you an example. In the early days in the basement of a church, I had a board member who hired his cousin, his nephew, really, it's his nephew, and he was over the books. And he took the books home, the accounting books home with him. Well, when I'm trying to get financial reports to report to the board and to the federal government, he didn't have the books. They were at home. So I'm a young upstart right out of college, and I've got pressures coming in me. So I fired him, told him to bring those books back. Didn't give him any due process, you know, didn't investigate. I knew where the books were. So I learned from that, and I got sued. Fortunately, Doc was a good lawyer, and there weren't any consequences from that. But I learned from that. That's a primary example. That was back in 73, 74, somewhere back in there.
So, you know, one of the things that I think that's interesting that you talk about is managing stress. Is that something as a skill set you learned over time, or?
Yeah, that's something I've learned over time. And my key is for over a decade, years. I start my day out with devotionals, reading scripture. You know, now that my time is more my own, I spend Janice and I spend anywhere from 45 minutes to an hour reading scripture and devotion. But before I retired and I had pressure meetings, I would spend some part of my day meditating on the word. And that really helped me a lot. And then you find balance in your life, personal life, where you don't think about work. You know, you try to take care of yourself physically and mentally. You just balance. And the only thing you can control is how you respond to things that come at you. Learn to control the things. You know, if you react to it, then the external environment is controlling you.
Right.
If somebody's giving you something that stresses you out and you just react to it, that person is controlling you. How you respond to whatever's coming at you is your best way to eliminate stress. You're not sure what to say, count to 10 before you respond. Silence is golden. People get uncomfortable when you're silent. People get uncomfortable. So if somebody says something you're not sure what to say, just count to 10.
Right. So we're going to take some questions here from the chat.
Okay.
One of the perks wants to know, in 2022, what are your views on community Black churches collaborating with Swope Health with the focus on giving Swope Health room with regard to in terms of helping with their I guess asking with programs collaborating with churches today with Swope Health?
I think that's great. I mean, we did that. Like I said, we did that early on. We collaborated with a lot of the churches, Metropolitan, and Reverend Handy. Reverend Handy, I asked Dr. Hartsfield if he wanted to do it. He said, Frank, I'm too busy. But we met Reverend Handy, and he had a health ministry program for us, for our homeless, for our patients who had mental illness, for our patients who had chemical dependencies. He had a health ministry program where he had appointments. He had church service. Reverend Ivy Ganaway, she was an RN. Reverend Tyndall introduced us to her. And we set up a whole program around infant mortality and low birth rates. And Rogers collaborated on that. She went around to the various churches to help young women who were at risk for pregnancy, at risk teenage pregnancy. and outreach effort, and that was faith-based. So yeah, I'm a strong believer in bringing faith into healthcare, holistic, very much so.
We have another question here, more of a statement, I guess, not so much a question, from Janice Love. She's asking if
Oh yeah.
she says she would love to have you do a leadership training session for our managers in our new leadership development program, if you're interested.
Oh sure, I'd be happy to. Yeah, I'd be happy.
Okay.
Yeah.
Okay. Well, it sounds like you have a lot of wisdom to give.
Yeah.
So, so as we're closing up here, Mr. Ellis, one of the things that I'd like to follow with is two questions. You talked a little bit about the challenges you had in '08. What would you say was the greatest challenge you faced during your tenure at Swope?
The greatest challenge was what I said: '08, '09, 10, 11, and 12. Those were, I mean, when you have to eliminate and dissolve companies that you spent hard-earned effort with your team to create, and to dissolve those through no fault of your own. I mean, nobody, I mean, if I was evaluated on '09, I would not have put that on my tornado chart, because who would have thought the economy would have collapsed?
Yeah.
Think about this. Lehman Brothers had a AAA rating by the underwriters before they went bankrupt. Lehman Brothers had a AAA rating, and yet they went bankrupt under, credit swap derivatives, which were instruments that didn't have any valuation tied to any asset, and they brought the whole economy down.
Right.
And who would have thought that? So everything was losing money. The only thing that was really stable was Swope Health Services, quite candidly. And it still lost some money. But if you look back on those financial records, you'll see that the cornerstone was the healthcare component. Everything else peripheral was struggling, even the parent, SCE, because it was all investment dollars. And it lost 45% of its valuation in those 4 months.
And what would you say was your greatest accomplishment as your tenure here at Swope?
I like to think the healthcare that I delivered, and the jobs I created, and the people that I worked with, I think was the greatest. I mean, we had a lot. Swope still has a lot of great professionals, board members. We learned a lot from each other. We helped each other. We struggled a lot in challenges. We didn't always agree, but we had a lot of, everybody, one thing you can always say about everybody at Swope, we all agreed on the mission. We may have disagreed on how to go about it, but everybody believed in the mission all the way through. There was some disagreement over whether we should set up an insurance company, and if the insurance company should be for profit. But when it all boiled down to who's going to take 25, 30 cents on the dollar when you were making 75 cents on every dollar the government gave you, and now you got to work with Truman and Children's only to get 35 cents. That's why we set it up.
So, challenging you back to what you were saying with Doc Holliday, if you were thinking big, what would you say is the future of community health centers over the next 10 years?
Oh, I think the future of community health centers are bright. I think the key, I was worried, I have to say this, at the 50th gala, I said some of this. I was worried when Trump came in, because they wanted to do away with some of that. But I think as long as there are poor folks, and as long as there are Medicaid folks, community health centers have a role. And I don't see, the Bible says there will always be poor folks among you. And so as long as health centers stay true to that mission, and then incrementally expand in their core competencies, I see the future as being very bright. You stay in those 3 life cycles I gave you, I presented. If you ever start to get complacent, or you decide to grow for just for growth's sake, you got to manage your risk. But there are some health centers throughout the country there, along with Swope, they're doing some very great things up in Chicago and Texas. Swope just launched that PACE program, which is great. That's sorely needed. And that can be expanded on. So yeah, I see the future is bright.
Well, Mr. Ellis, I want to thank you again for joining us today and joining us on the third installment of our Black History Lunch and Learn series. This has been a riveting conversation, and I know that you're very busy, and so we just thank you again for spending the hour with us today on this Wednesday.
Well, I'm happy to do it. Congratulations to you, Darren, and your leadership on this too. Give my best.
Thank you so much.
Give my best to everyone.
Thank you so much, and thank you all for joining us, and I hope you join us next Thursday from noon to 1 with Congressman Cleaver. Thank you all so much. Thank you, Mr. Ellis.
Thank you.